Hello, everybody. Dr. Ryan Bowman coming to you today, wanting to talk with you about how to beat the colds and beat the flu that is coming around here before we know it. When you stop to think about the daunting task of trying to avoid all the cold and flu viruses that are out there, you'll quickly realize that it is, quite frankly, impossible. So, our number one strategy should be to strengthen your immune system. And it is indeed possible to reduce your chances of getting a cold or flu by over 80%. And when you stop to consider that our own CDC tells us that the flu shot is only 30 to 55% or so effective, depending on the year that you look at, you realize that there has to be a better way than that. And the way that we're going to talk about today is optimizing your vitamin D level. And whether we look at uh, the October 2007 issue of Epidemiology and Infection, or the February 2010 issue of Integrated Medicine, or the July 2009 issue of the Annals of Epidemiology, we come away with several different conclusions. One is that it is indeed possible to reduce the incidence of cold and flu really close to zero by optimizing your vitamin D levels. Now, we also learned that those with vitamin D deficiency spend virtually 40% more on healthcare than those with normal or optimal vitamin D levels. We also learned that optimizing vitamin D helps prevent breast cancer, colon cancer, and dementia. And those are conditions that have been researched, and who knows, there might be more. So it's safe to say that optimizing your vitamin D level is well worth it. But the question is, how do you do that? Well, the best way to optimize your vitamin D is through sunshine. The UVB rays from the sun react with cholesterol underneath the surface of your skin, triggers a process by which then your body makes its own vitamin D. That's for sure the best way. However, if you don't get enough sunshine, which certainly when you live in northern climates from basically September to May, it's almost impossible to get enough sunshine. So we need to supplement. That is the next best way. We work with two products here in the office, both of which are really high quality, wonderful value. And for adults, we use this product here from NutraWest. This bottle will last an adult 120 days, giving them 5,000 international units per day, which is the optimum dosage for most adults. Some adults need more, depending on where your values are, but this works for 80% of people. For children, we use a spray to give them 2,000 international units per day. This is orange flavored, big hit with the kids, and really keeps their immune system working at its best year round, but especially through those difficult winter months. So if you've had your vitamin D tested, which more and more people are getting it tested anymore, you've maybe noticed that the normal range is pretty broad, ranging anywhere from 30 to 100. But if we look at optimizing the function of your immune system, strengthening your immune system, your goal is to get above 50. If you get anywhere in the mid 50s to 60, anywhere in that range, you will notice a significant difference in how well your immune system function, especially if you've been hanging out in a range of about 20, which is where I find a lot of patients are the first time they get tested if they have not been supplementing. So just to review here real quickly, 5,000 international units per day for adults, 2,000 for children. You can get either one of these products at the front desk. We keep them stocked year-round, whether it be for adults, children, or both. And so once again, this is Dr. Ryan Bowman, and just wanting to wish you and your family a cold and flu-free season.